Will you feel pain during cataract surgery, and what is it that you can expect in terms of pain and anesthesia in surgery? These are very common doubts that people have. So today we're going to be talking about different anesthesia options available to a patient during and for cataract surgery. Hi, I'm Dr. Krishna Poojita from Pixel Eye Hospital. So normally with the advanced cataract surgery that we have today, the most widely used and most common method of giving anesthesia is called as topical anesthesia. Topical anesthesia means we use eye drops. These are anesthetic eye drops. These drops are put multiple times before you are taken into the operation theatre and before the surgery begins, and sometimes even during the surgery, so that you don't feel the pain. So with these drops, however, your eyeball is capable of moving here and there. You will feel some sensations like, say, the water being put in the eye or some cleaning solutions that are used during the surgery. You might feel touch, but you will not feel the pain. If you feel the pain, we can additionally add those drops during the surgery so that the pain comes down. So 95% of the cataract surgery cases that are done here and also wide across the world are using these topical anesthetic drops. The only cooperation that is required from you as a patient undergoing surgery is to look at the light that is coming from the top and not move your eyes too much here and there. So that's about topical anesthesia. You don't have to worry about it. It's pretty comfortable and quite smooth. The other type of anesthesia that is used in certain specific cases is called as local anesthesia. So in that, the anesthetic agent is taken in a syringe and few injections are given around the eye so that the anesthetic effect is reaching all across the eye. So when local anesthesia is given, the eyeball also will not move and the lid will become shut. Okay, so there will be no pain, there will be no movement of the eye, and also eyelid will be shut. In such cases, there is a patch that is put after the surgery so that you go back home and after 3 to 4 hours you can remove the patch and start using the drops. So why is this kind of anesthesia used in specific cases? So there are certain conditions where maybe the pupil inside the eye is not dilating. We may require some additional procedures to be done like a pupil dilation or something else like a pterygium excision during a cataract surgery along with the cataract surgery. So these are conditions which might cause a little bit more pain and the patient may not be able to tolerate very easily, and in such cases we usually give, or in cases of even a mature cataract where the patient is not able to focus at the light. So in addition to relief from pain, we don't want the eyeball to move here and there. That is when we go for a local anesthesia or an injection based anesthesia. Now in both these anesthetic methods, the patient is awake, the patient is conscious, they can hear everything and they will be lying down however, but listening to everything that is going on. Now the third type of anesthesia, which most people expect that's how it's going to be, is called as a general anesthesia. Now general anesthesia is almost less than 1% of the times used for cataract surgery. In only most common places where we use a general anesthesia and cataract is in pediatric cataract surgeries, because in kids it is extremely difficult to expect any kind of cooperation and they are more sensitive. So we always, when there are small babies or kids who are undergoing cataract surgery, we do them under general anesthesia. But other than that, most likely, almost never, we do not use general anesthesia in cataract surgery. So general anesthesia is where you are what a patient expects to be unconscious, and you do not know what is happening, and then you are sleeping most of the times. So that is the expectation. We do not use it. Then the fourth thing that we very commonly do in certain very specific cases is called as surgery under sedation. So it is not a general anesthesia, it is just a sedative or a sleeping sort of a agent that is given so that the patient is more comfortable during the surgery. This is done when, in some cases, people have claustrophobia. So the moment during the surgery a drape or a sheet is placed in front of the eye, or a sheet is covered on the eye, which is necessary for a cataract surgery, the patient may become extremely anxious and distressed and may not be able to cooperate during the surgery. So in such cases where they have extreme claustrophobia or extreme amount of fear and anxiety, wherein they may not let us complete the surgery very well, we usually tend to give an additional sedation with anesthetist in the OT and then go ahead with the surgery. Now, there are times that we may start off with a topical anesthesia by putting the drops, but during the surgery we may feel that the patient is not cooperative or feeling too much pain. In such cases, we also inject some amount of anesthetic agent near the eye, into the eye, and also give a small injection around the eye during the surgery. So this is also a possibility in case there is something that we notice on table. So I hope the process of anesthesia in cataract surgery is clear. In all these methods, you will not have pain. The only difference between all these methods is the ability to move the eyeball or the ability to keep the lid open. That is where the variation exists. Thank you.